called the head stress. So, according to the severity of the head stress, it's gonna be heat rash. What does it mean, heat rash? Elements related to our skin. Some color, some get burned. This is the heat rash. And next thing, the hard collapse. You know all what does it mean collapse? Collapse is some fall. This is the collapse. So, next thing, the heat cramps. What is heat cramps? Related to our muscles. Our muscles will be tight strongly and cannot release. This is the heat cramps. The muscles, all the body muscles. And next thing, the heat exhaustion. Then I can say that the heat exhaustion is the minor of the heat stroke. So the heat stroke is the most severe from the heat stress. What is the heat exhaustion? Is the circulatory deficiency. Blood circulation cannot do its blood circulation as now. And heat stroke, you can be die, you can be coma, you can be another symptoms related to the heat stroke. So the heat stroke is the most severe of the heat stress. A lot of factors can cause and aggravate the heat stress, starting from the high temperature and high humidity also, and type of clothing that we are wearing, and the physical activity that we are carrying out, welding, inside the confined space and others, and the head surface in the area, and the lower level of air movements in the zone that we are carrying out our activities. Those are all the factors related to the heat stress, can cause the heat stress. And another factors we call contributing factors can aggravate the heat stress. That stress can be caused by those factors, humidity, temperature, hot sources, and such, and can aggravate by contributing factors. I can say that the combination of two or more contributing factors can make the heat stress grow. So I can aggravate. Those contributing including the age, the physical condition, the time of work, photo environment, geographic that we are work, season of the year, time of the day, and the exposure. We will see those contributing factors one by one. So, what you are seeing here, what can you conclude? Now, what is the difference between this person and this one?
One is young.
Huh?
Yes.
One young and
And one is old.
This is too young and this is too old.
Yes.
So I can understand that young people and old people can suffer from the heat stress more than others. This is from the age. And next thing,
Yes.
the unfit, the physically unfit people are more likely to suffer from the heat stress also. And what is this? Huh? Yeah, the kind of the physical activity that you are carrying out, such as the steel structure erection, manual excavation, using of chipping works, and grinding, and concrete pouring. Those are all some physical activities, some how to say, strong physical activities. So those people engaged in the manual tube of work are more likely to suffer from that heat stress. And next thing is the work environment. So the people are working under the sunlight, for example, and the open area are more likely to suffer from the heat stress also. And next thing, the type of the work. So the people working near the heat generating equipment or in the poorly ventilated area are more likely to suffer from the heat stress. People working inside the tunnels, people working inside the confined spaces are general. People working, for example, in the black top or any hot surface, welding, grinding, and using of gas cylinder. Those are all hot sources. can aggravate the heat stress also. And next is the exposure. So the people working continuously without rest period are more likely to suffer from the heat stress. And according to this, we have always to schedule. This is some kind of technical control measure to schedule our rest. And next thing is the time of day. Now always to avoid the peak high time. Peak high temperature time. From, for example, 10, not 10, 11, 12, like this, in this geography. Huh? 11, maybe 11 or 12, 2, 3 o'clock. This time, so the people working in an open area between 10 and 3, here we can say 12 and 3 p.m. are more likely to suffer from the heat stress due to the high ambient temperature. And next thing is the geography, such as Saudi Arabia, Emirates, Qatar. All those are hot geographic areas. So they are more likely to suffer from the heat stress than a non. I will check this person and I will come back. So another workers working water. And now we will see the symptoms of the heat stress. I said in the beginning of this awareness that we should continuously observe any heat stress sign and symptom. So we have to now do symptoms such as refuse switching. You know switching? Lost your water. This is switching. When you come out, switching here, like this. Okay? And general body weakness. You cannot daily do the activities. And high body temperature. Your body become high temperature. And pale skin. What does it mean pale skin? The color become some kind of darkness color of your skin. And dizziness. The dizziness or you can become unconscious, collapse, fall down. This is dizziness. And nausea. What does it mean nausea? Return back from your stomach. Return back. This is nausea. So how to stop the work stress? I have always to make sure that there is control measure of the heat stress according to the hierarchy of course. The hierarchy is elimination, reduce, isolation, and general control, technical control, personal protective equipment, and some if we need disciplinary action. So we start by engineering control. Always we have to provide shelter. What does it mean shelter? Rest. Rest.
Shelter.
Shelter. That's that. Rest shelter. And if we need, if required, we have to provide air ventilation such as fan or air portable in the rest shelter if required. If we don't require, just the natural air we can use in our rest shelter. This is number one. Number two, local ventilation. As I said, always, not always, but when necessary, have to provide the local ventilation as engineering control, using the fan, air, movers, and all. And the portable air cooling system. This is the portable air cooling system to create some cool air in the area. And those are the administrative controls. The administrative controls include the scheduling, acclimatization, water replacement. What we schedule exactly, we have to schedule our work, our rest, our drinkable water needed, and acclimatization. The acclimatization regarding on all new hire, new persons shift from site to site, visitors. Those are not working with us for a long time. So we have to acclimatization, make some acclimatization for them. Don't push them in the hot works, hot environment directly for a long time exposure. And the water replacement. Always I have to replace the water for our body because I always use our body always use the water, such as switching, respiratory reactions, and urine. So we lost water. Okay? So I have always to replace this water by drinking. And be careful, do not drink only when you feel thirsty. Understand? When you feel thirsty, it means your body starts suffering. So you are in very, very serious condition. Always you have to drink the water before to start thirsty. And always we have to monitor our salt, correct salt in our body. This is we call the electrolyte replacement. And don't worry for this. This is the yes. That can go. This is don't worry about this issue because the salt replacement can be achieved through a normal, healthy diet. So we are not more required for the salt tablets. And I can say that the long-term effects for the salt can cause stroke. Please focus in this awareness.
Yes.
And the sport drinks, it's better. You can use the sport drinks. Okay? And the last thing, as a control measure or safety barrier, is the personal protective equipment, so PPE. So I can say that. What is PPE? No.
Personal monitoring.
Personal monitoring.
Yes.
This is the personal monitoring. The monitoring now always to ensure good supervision, good monitoring in purpose to continuously observing any signs for the heat stress and any symptoms. And always we have to be ready for the emergency. Okay? Next thing, this is the heat index, and this is the heat index matrix. According to the heat index matrix, that's based on two main factors, humidity and air temperature. We can get the heat category. So according to this matrix, we have 4 heat categories. For each heat category, special color and special flag. So those heat category starting from 25 to 29 of heat index. This is the cushion heat category. Between 30 and 38, this is the extreme cushion heat category. Between 39 and 51, this is the danger, orange color. And the red color is up to 52 of heat index. This is extreme danger heat category. Those are the heat categories. Caution, extreme caution danger, and extreme danger. And this is the heat index. And here we can see some symptoms of each category. For example, here we can feel fatigue, here heat cramps and heat exhaustion, and heat stroke is possible if we have continuously carrying out a physical activity, the same for the danger, and heat stroke for the external. And here our schedule. Which schedule? Here our working and rest schedule. For example, in the extreme cushion category, we have to work 50 minutes and take rest during 10 minutes in the shower, rest children. And for the danger, we have to work 30 minutes and take rest during 10 minutes. And like this for the extreme cushion heat category. And here, our schedule also for the water replacement. The water needed, 1 cup each 20 minutes for the cushion, and 1 cup each 15 minutes for the danger, and each 10 minutes for the extra danger category. And here the control measure. So for the cushion, only visual monitoring, and there is no work alone. For the extra cushion, and always we work only under shock. For the extra danger, and additional control measures such as close monitoring, shower, drinkable water, and monitoring, supervision, and additional control measures according to the construction safety manual required in the extra danger category. There is nothing says that we have to stop in this induction, heat induction. This is for the safety, nothing or reason. Before, when I worked before, there is flag, black flag. According to certain heat index, we have to stop. We are not allowed to catch it. But here, until now, I did not read anything like this. So they talk about only countermeasure, additional countermeasure. Okay? So the personal protective equipment is the last barrier in the risk hierarchy countermeasure. So we can use the PPE, personal protective specific PPEs, such as the IC cooling garments. This is including the IC clothes, and the cooling, such as the light cooling and the light color and the lightweight. The cloth, lightweight and light color, and the breathable clothing. Breathable clothing that has small things that can let the air pass through. This we call breathable clothing. And weighted clothing can be used in weighted clothing and towels. We can make some water in our clothes or on our towels and use. Okay, this is such as personal protective equipment. Now the emergency procedure. For the emergency procedure, I have always to inform, to report to the foreman, site engineer, HSE immediately if there is any symptom of the distress. This is number one. Number two, bring the person under the shabby place and losing clothing. Here we have to lose. And give water if he is conscious. Give his water. And transport person to the clinic nearest if required. Okay? Here we gave you already the emergency contacts. If there is any emergency, just contact the clinic or the nurse or the ambulance, and they will come and bring to the hospital or the clinic, and they will do the necessary. This is for the emergency. Now, some description, symptoms, treatment regarding the dehydration, head exhaust, and head shock. So the dehydration, so the water is being lost from the body through the switching, through the respiratory system, through the urine. This is the water is being lost from the body faster than the replacement. You cannot replace all the needed water in your body. This is the dehydration. The symptoms of the dehydration increase in pulse rate. This is heart pumping. And next thing, increase in the body temperature and irritability for your skin on all your body. And restlessness. Restlessness, you cannot sleep. This is restlessness. And loss of work efficiency. And the treatment is remove the casualty from the head surface and slowly drink 1 liter of water, let him take rest, and he can return back for the work. Okay? This is not a serious condition. The serious conditions start from the head exhaustion. So, the head exhaustion, the body still can cool itself. Okay? Yes, there is the circulatory deficiency, but our body can cool itself down. But be careful. If there is any treatment of countermeasure, you're gonna be headstrong. You can, in very serious condition, headstrong. So, in that case, you have always to make some countermeasure treatment immediately treat this casualty. The symptoms of for the head exhaustion is clammy, humid skin. This is humid skin, and weak pulse. The heart pumping will reduce. Reduce small. This is weak pulse and fitness. Can feel weak, tired, nausea, return back from your stomach. Headache for your head, too much headache, and facial failure. This is the color of your face, and stumbling. What does it mean, stumbling? You cannot keep in the upright position like this. Simple, okay? And general tiredness. For the treatment, remove the casualty from the hip thrust, sit in the position with leg raised, and slowly drink 1 liter of water. Let him take rest, and before to return for the work, you have to consult the medical. All safe. Okay? Next thing and last thing is the head stroke. This is the most simple. In this case, the body cannot cool itself down. So, the head stroke is the life-threatening and must be treated as emergency immediately. The body has lost the ability to cool itself down. You can die from this. So, the symptoms: hot and dry skin, high temperature, low blood pressure, and delirium. Delirium, it means you cannot say what are you doing. You cannot say what are you saying. This is delirium. And convulsion, muscle tightening, such as the cramps, and coma, and you can die. So the treatment, always we have to activate the emergency response plan and reduce the temperature by sponging with cold water, sponging like this, with cold water, and blow with cool and dry air. Okay? And next thing, remove from the head source. The most important is to activate the emergency. Okay? So, in case of the head stroke, always move the patient to the cold environment and seek the patient's clothing with water and apply the cool packs continuously. Place them in tube of cool water and circulate the air around the patient. This is the emergency for the head stroke. Now, the summary for all this heat stress awareness. So, the heat stress occurs when the body suffers from the overheating. It's gonna be heat rash, heat collapse, heat cramps, heat exhaustion, and heat stroke. This is according to the severity. And the heat stroke can result in the death. This is very important. And first aid aiders or the doctor, somebody knows about this issue, has to contact immediately if there is any signs of the heat stroke. And the heat stress can be prevented by adapting the work schedule. As we said, we have always to schedule our work, our rest, drinking water, reducing the heat exposure, and increasing the airflow using the fan air movers, and drinking water frequently. Don't wait until you feel thirsty. Always to drink the water. And adapting to the heat. This is acclimatization. New person shifts from geographic zone to another, and having frequent rest break in the rest shelter, and always wearing the protective clothing that cover the maximum of your body with long sleeves, and monitoring yourself and your environment. You have to provide good supervision, good monitoring, and continuously observing any signs for the heat stress. Okay? And that's the end of